welcome. We are excited to talk to you guys about Breastfeeding Friends. My name is Rhonda. This is Cristin. We are lactation consultants here at Owensboro Health, and we have a few exciting things to talk about this week. And the first is about our NICU 10-year anniversary. And I don't know if you see this beautiful piece of artwork here, but this was done this last week.
Yeah, so 10 years ago, last week was the anniversary of the opening of the NICU here at Owensboro Health. And so they had a celebration and unveiled this piece of artwork that was done in partnership with the Owensboro Museum of Fine Art. Each square is done by one of our NICU graduates, and they did it last summer at the NICU reunion. They each got a square, and so it's exciting to see it put up and all together now. And this is right outside our lactation services office in front of the entrance to the NICU, so people can see it when they come to visit us.
All right, so the other thing that we thought we could talk about is flu and RSV. It is that season where everybody seems to have a cold or the flu. And since we were talking about...
We've been getting a lot of questions from people calling in. We've been seeing a lot more new cases here in our community, newly diagnosed flu. So what can we do for our breastfeeding moms that get the flu?
So we always want to make sure to remind you guys that you want to talk to your provider if you feel like you're not feeling well, so they can help kind of figure out what's going on. And then also, if you have any concerns about your baby, you always want to talk to your baby's pediatrician as well. But things that you can do is breastfeed. Breastfeeding has great germ fighters in it. And so some people have concerns about breastfeeding and flu, and so we thought we could talk a little bit more about that.
Yeah, so you can't get the flu from breast milk. It comes from saliva, so when people cough or sneeze and touch different things. So hand washing is really important to help avoid the spread of the flu. And like Rhonda said, there's lots of antibodies in your breast milk that can help protect your baby if you get the flu. And if you have to pump, if you're feeling sick and too sick to take care of your baby and somebody else needs to take care of the baby for you, we want them to be well and wash your hands really well before you touch your pump parts or you express milk. But somebody else can give that milk to your baby until you're feeling better when you're more up on your feet.
So yes, even if you do have the flu, if you're sick, it's still encouraged by the CDC to breastfeed. If you have questions about the flu and breastfeeding, the CDC, Centers for Disease Control, is a great website to go to, and we'll have the link down below for you.
Yeah, and so that's one of the new recommendations the CDC has released, is that they do recommend breastfeeding moms that have been prescribed medicine by their provider that Tamiflu is a good choice. There are some other medicines out there, but there's just not as much information. So you can take Tamiflu with breastfeeding, but again, if you have any questions, we want you to call your provider. Other things, with the flu, people can get nasal congestion and stuffy noses, and a lot of the medicines that you take for congestion can impact your milk supply and can decrease how much milk you're making. So a better choice are going to be those type of decongestants that you can spray in your nose instead of taking a pill that affects your whole body.
And with any sickness, whether it be a flu or cold or you're just not feeling well, you always want to make sure that you're taking care of yourself too. So making sure you get plenty of rest. Sleep when baby sleeps as best you can. Making sure you stay hydrated and taking care of yourself. Eating healthy foods.
Yeah, because when you're feeling bad and run down, it can impact the amount of milk that you make. It can also make you more prone to things like breast infections and mastitis. So if you find that you're having any difficulties with breastfeeding after having the flu, come see us over at Lactation Services or give us a call. That's the kind of stuff that we talk about at Breastfeeding Friends.
Yeah,
right?
Which is this weekend.
Yes. So I'll be doing it this weekend. So you come over and meet us in the main entrance to the hospital. In the seating behind the elevators is where we all meet up, and I'll have my scale, and we'll get to visit with each other, celebrate breastfeeding, and help each other with different things that we're facing each day as our babies are growing up.
So if you have more questions about the flu or something else, Breastfeeding Friends is a great time to stop by, hang out with some friends who are also going through similar things. And so we hope you guys join us.
See you then.